Well, here we are with Dr. Kahan. How are you, Dr. Kahan?
I'm doing great, Emmett. How are you this morning?
Good. Dr. Kahan, I want to talk a little bit more about, some of the stuff a podiatrist doesn't do and how he does it and what us patients, should pay attention to and maybe fear. Maybe there's nothing to fear. But in any case, tell me, why is it that podiatrists are so important in helping to treat and in diagnosing with diabetes? What the heck does diabetes and feet have in common?
Wow, talk about a loaded question. How many hours do we have?
You have 4.5 minutes.
Okay, here's the condensed version. As you know, but
as
most people may not know.
Probably, as I should know. Probably.
Well, okay. Now down to 4 minutes. The biggest relationship between the feet and diabetes is the grueling fact that as the diabetes progresses, the longer somebody has diabetes, and it really is irrelevant whether they take insulin or pills, is that their circulation is going to be affected at some point. Their nerve sensation is going to be affected at some point. Why is that important? As a diabetic walks along, they lose feeling. They can't feel their shoes. They can't feel the ground. They really can't tell. There's no message from their foot to their brain that says, hey, there's a rock in your shoe. There's a screw in your shoe. There's a thumbtack in your screw in your shoe. They lose circulation. So if they don't pay attention and if they don't look at their feet on a regular basis and they look down at their feet every so often and they look, maybe they're kind of purple, but they're all purple. They think, well, it's normal. They're all purple. Well, purple's not a good color. If you look at your fingertips or your toes, you don't want purple. It should be nice and pink. So with the circulation issues, it's huge. Diabetics all at some point will have circulation problems. They will have sensation problems where they don't feel very well. A lot of diabetics will have vision problems, all related to the same nerve and circulation problems. As a result, if you have poor circulation to your feet, for example, well, every body part, and the largest body part we own is our skin. Without good circulation to the skin starts to break down, change colors, it opens up, it gets infected. Diabetic gets an infection, most of the time it's treatable. But if it prolongs too long without being properly diagnosed, then we all know the potential outcome for a diabetic is losing a part, losing a toe, losing a foot, losing a leg, worst case scenario, and possibly losing their life over something that was probably preventable with regular visits to their podiatrist every month, every 2 months, every 3 months at least, to help prevent some of these problems from showing up.
Okay, so
or at least being properly diagnosed.
Let me see where I got that. So diabetes inhibits circulation in the whole body, period, right?
You bet.
All right. So feet, I don't know, but are you kind of telling me that one of the reasons it is so important, diabetes and feet, is because the feet, to a certain degree, are relatively heavy difficult to circulate for the body. And so the circulation problem in the feet, whether it's difficult or not, but circulation problem in the feet show up extremely magnified. After all, every single nerve goes through the foot sole, and so there's all those nerves there, there's all this bad circulation there. The feet are carrying us, so if you don't take care of it immediately, your feet might be losing circulation so badly that they may have to be amputated, because it is so difficult to get circulation there. Because after all, when we get cramps or certain things, it usually happens in the foot. Apparently, there's some difficulty to pump the blood all the way down there or so. Is that what we're talking about?
To a certain extent, yeah. What people need to realize is that, the arteries in the heart, they're very big, and as the blood flows out to whether your fingertips or your toes, they get smaller and smaller and smaller. You know, you take an artery that starts this big in the heart, by the time it gets to the foot, you know, it's the size of a pin. And if those small and medium-sized arteries start to clog up, that's where we run into problems. And that's the most common issue with diabetics is the medium-sized blood vessels that start to just close up. And again, not necessarily a preventable problem, but with regular checks, we, you know, as a podiatrist, either we can do the circulation check or we have good associations with circulation specialists where they can check that out and we can circumvent these problems. Boom, right now. And you know what? Tomorrow you're living back to a normal life. Prevention is the key. It's regular checkups, which leads to prevention, which leads to living a normal life, long and healthy.
What does this regular checkup prevent? Does it prevent the diabetes, or does it prevent the diabetes from taking its toll on the leg?
There you go. Exactly. It prevents the diabetes from taking its toll on the leg, and that's why it's so important for them to see their primary doctor, that they have an eye doctor, a foot doctor, a diabetic specialist, if you will, or an endocrinologist. You cannot, unfortunately, probably preventing diabetes is a very difficult thing, but preventing the complications and problems associated with diabetes, most of that can be caught, you know, fairly early to either minimize or to squash that problem, period. So there's a lot of issues taking place here.
I got it. So is it a little bit like, let's assume you cannot prevent a drought in a desert. You know, I live here in California, and you cannot prevent certain droughts. But what you can do is put water tanks up, put certain irrigation, do things while things are good, so that the drought, while still being complicated, while still not, you know, but the bad effects of the drought can be somewhat, if not totally, circumstances and bypassed. Is that basically what you're saying?
Absolutely. There's two key words: proactive versus reactive. If you're proactive, you prevent. If you're reactive, that's where you're going to run into potential problems. Prevent the problem, you know, be proactive. Okay. Don't assume that you're going to be okay.
Okay. Well, let me ask you this. Is it possible that a guy runs around and having like some, I guess you guys call it an onset of diabetes? Basically, you know, it's like at the very beginning stages. It's kind of crawling around there, sniffing in every so often. Is it possible that a regular visit to a podiatrist, the podiatrist goes, you know, there's something not quite right with your circulation, and by doing so actually finds out that the person might be diabetes prone, and then with the normal doctor and with everyone else even goes and says, oops, correct diet, more exercise, whatever it takes, he can then make provisions there as well. Is that a possibility also?
Absolutely. I'm going to tell you what, a podiatrist, and I'm going to throw a number on this, that has been in practice at least 5 years. And because in 5 years, you know, you learn to be suspicious about certain things, especially with diabetics. There is something about the extremities of a diabetic that you can look at, and whether they are or not, you say, wow, has anybody ever told you that you're diabetic? And the patient looks at you dumbfounded and said, no, but you know what, my grandfather had it, and my dad had it, but nobody in my family has it. And I say, you know what? Next time you go to the doctor, if we don't do it today, we're checking for diabetes, because there's something going on here that just is not right. And the extremities and the feet, I'll tell you what, they can tell a big story about a diabetic who may not think they're diabetic yet. So very, very telltale signs in the feet and extremities of a diabetic.
Wonderful. So obviously a podiatrist is very important for that. And at the same token, you say that any type of doctor which deals with the extremities, and for instance an eye doctor where the blood vessels or whatever you call those things are super thin also, those type of doctors are are quite a good gauging for, as long as you're okay in the extremities and the eyes, you're still in pretty good shape. And if anything goes wrong there, then you can find out that you may be having diabetes or at least a candidate for it, and start changing your lifestyle. And if that is already too late, or the lifestyle change doesn't come, which many of us is happening, it's just, we say we want to live longer and better, but we still don't want to give up whatever we just got used to. That just seems to be a common denominator. We're a little suicidal, I guess, all of us, most of us. And so if that happens, if the person doesn't change and he does get the diabetes, no matter what he does for handling the diabetes, he also must do something to keep the extremities, in this case the feet, well circulated, and that is then again a podiatry can help there doing that, right?
Absolutely. There's absolutely no doubt about it. Cannot emphasize enough regular care, being proactive again as opposed to reactive. There's not a doctor on earth that has not just grabbed their diabetic patient that's very stubborn by the neck and say, listen, if you don't do what we tell you, you're not going to be around for us to tell you what you need to do. And sometimes that gets the point across, but, there's a bit of stubbornness in all of us. But some people take it to the extreme, and we hope it's not our patients.
Right. Okay. Well, thank you very much for this enlightening interview. Podiatrists can find that a person is borderline diabetes. That's good. If a person is already diabetes, and if he does know it, going to a podiatrist is super important, because the podiatrist can make sure that whatever needs to be done to keep the circulation going is happening, so that you then in the end won't lose your leg, because apparently the heart has a hell of a time pumping that blood down there and getting it back up to the body, so it kind of like keeps staying there and not circulating by definition, I guess. And so either way, there are two aspects to it. A, detected perhaps diabetes because something is going on with the extremities, and the other one is, okay, you have it. It's kind of difficult to get rid of it, but you and your other doctors do what you do. But boy, you better keep coming and making sure that your feet all the time have the potential circulation they need, and then you guys do what needs to be done to make that happen.
Absolutely. That's it in a nutshell.
Well, wonderful. I love it. Thank you very much, Dr. Kahan.
Thank you.